Hey all, Casey here. I just want to do a quick video on recall processes and how we do this at Condamine Medical Center. That's a practice that I'm owner of and working in. Recall process is a really important thing to get right. It can really chew up a lot of time if it's not right. Chew up time in terms of your nurse, admin, staff, patient booking appointments that potentially they don't need because results have already been given but not marked off. So this is what we've developed. I don't want to promise it's perfect. This is something that we've developed in the context of likely AI. Will cover a lot of these things very soon. So if you've ever heard of AI receptionists, essentially patients will call in and get booked appointments with reception. You can do outbound calls, not appointments, with your AI receptionist, where they'll call a patient, say, look, there is a non-urgent result. I can book you in right now. I think the benefit of doing something like that, this is in the future, of course, doing something like that will be that a patient will get a call and they'll essentially just book in straight away, and it'll be a fair bit easier instead of this recall process where we're sort of sending out messages. So what we've tried to do is develop this flow chart in the context of that is likely going to be coming very soon. So I work with MBS Pro, that's my other company, where we do a lot of things with AI. We have AI receptionists, and this is what we're developing. Being a practice owner, I know that recalls are a pain, so if we can offload a significant amount of that to receptionists, I think it will result in better patient outcomes and also make the team a lot happier. So I'll go through this. So when we designed this recall process, it was essentially designed with a couple of things in mind. So one, we just wanted to get the doctors doing what they do best, which is seeing patients, treating their patients, and pretty much that. We wanted to offload as much as we could of the recall process onto nursing admin systems and eventually AI. And therefore, we developed this with that goal in mind. So the way that works, we sort of have a three-pronged system. So, you start, your patient comes in, they get a test. If it's an urgent, your potassium is way off, or troponins elevated, or something like that, we say that that's probably that's a doctor responsibility. Either the doctor can call directly or they can delegate it to a nurse, but it needs to come from a doctor that is an urgent result, and the patient needs to be notified immediately. So urgent is immediately. That's usually a phone call. If it's normal, we usually just send out a text that just says, your results are normal, and that's pretty much it. I know it says here no text, that should say just normal text. And then we have our non-urgent. So non-urgent is probably the tricky category. That's in between something that is urgent and needs to be dealt with straight away, and something that is not an issue and doesn't necessarily need to be dealt with. So a normal result would be something like your cholesterol is normal. You don't really need to call a patient in, especially if you've already chatted to them about it, to say your cholesterol is fine. There might be other reasons you call them in, of course. So non-urgent is your cholesterol is high, your sugars are a bit high, your full blood count says you've got a little bit of anemia, mild anemia, things like that, things that don't necessarily need to be seen within a day, probably not even within a week. Generally, we try and action these, as in see the patient, 2 to 4 weeks, depending on the result, but that's a general time frame. So what we do is we'll send, when the doctor marks it as non-urgent within best practice, or whatever your practice management software would be, we send a text. So we send out 4 texts, and we usually do these every 2 weeks. So they'll get at least a couple of texts before ideally they've booked an appointment, and they'll get a couple more if they haven't booked an appointment within that time frame. If they book an appointment, hopefully the doctor chats about whatever it is, and then they mark it off. Done. Easy. If the patient doesn't come in, or the patient has come in and we haven't marked it off, the nurses will get a list of all the patients that have had a non-urgent recall that hasn't been actioned. Nurses will review this list, and they will look through and just see if the results actually have been actioned. Sometimes the doctor will talk to the patient about a result and say, yep, we'll do these things, we'll manage it this way, and just forget to mark it off. So it keeps coming up on the list, keeps getting sent a text. So we can mark those off with the nurses, who will have a quick look and see if it has been discussed. Now, if it hasn't been discussed, so if it has been discussed, we'll mark it off the list. If it hasn't been discussed, or it's still on the list, we think the patient hasn't booked an appointment, we'll get our offsite team to give the patient a call. This is after we've already sent the text messages. The reason why we do that is we find it just generally a bit easier to call a patient immediately and say, this is a result that you need to come in for, and I'll book you right now. This is something that I think absolutely AI could do. So you could cut out, probably the bottom half of this appointment, because you could have the AI just start from here and call the patient and say, hey, you've got a non-urgent appointment. Don't even send them the 4 texts. Call the patient, and say, hey, we need to book you in for an appointment. So AI can absolutely do that. That's what we're developing with MBS Pro. And in terms of costs, text is cheap. It's like 5 cents or something like that. But a phone call, which is probably going to be 30 seconds, a minute, it's going to be very short. That's only going to cost a couple of cents as well, more than a text, but it's not going to cost a lot. The cost of 4 texts, it's 20 cents. The cost of nurses reviewing things and doctors reviewing things, that's, far in excess. So we're talking about saving a lot of time. So back to what we currently do. So we get our offsite team to give them a call, book them in. That seems to work very well. What that does is that essentially avoids the doctor having to look at this recall list, because it's automated with clinical oversight from our registered nurses. The only time that we get our doctors have a look at the list is if we've called them, we've sent them text, nothing's, like, we cannot contact them at all. We'll give that list to the doctor and say, this is your list of patients that we just haven't been able to contact. No one knows where they are. That's when we consider doing things like, there's sort of a few different options here. So one, is the test clinically indicated? Often we'll do a recall on, say, a specialist letter where there isn't actually any clinical indications, just, I want to review this letter with the patient. It's not something that needs to be happened. So the doctor might say, okay, that's fine. I'll just review them when they next come in. That's not an issue. There might be a misclick, so maybe they've clicked non-urgent on something that is actually just completely normal. Or it might be that we need to do something like a welfare check. This patient usually comes in, and it's strange that they haven't answered the text or the calls, and, do we need to do a welfare check? Otherwise, if the doctor says, yep, we need to do something about it, we will then send a registered post letterhead saying, you've got a result. We've done these things. We've contacted you a couple of times. We've sent you messages. We've called you. You need to come back in and review that. So that's what we do with our recall process. I'm really excited to see a significant amount of that to be offloaded to our AI receptionist, which I think will cut out a lot of this and make it so much easier, save our team a lot of time. So that's what we do with recalls. Let me know if there's any problems with that that you picked up. I know there's a few sort of spelling mistakes in that, but we've tried to simplify it and tried to make it so that we're not sending out so many registered post letters. We're contacting our patients before we get to that stage, because those letters are expensive to send. All right, hopefully that's been helpful. Thanks, everyone. Bye.